For the first time ever, the FDA is allowing a Florida health program to import some prescription drugs in bulk from Canada. The approval covers treatments for asthma, COPD, diabetes, HIV and AIDS, and mental illness. Only some people will qualify to receive the imported drugs, including foster children, prison inmates, and certain elderly patients. Stacie Dusetzina joins us now. She's a professor of health policy at Vanderbilt University. Professor, thanks for being with us. First of all, can you just remind us, drugs have long been cheaper in Canada. Why is that the case?
Yeah, that's the case because Canada negotiates for the prices of their drugs on behalf of their whole population. So they negotiate for everyone at the same time, not across multiple payers like we do in the U.S. And they also set a limit on how much they're willing to pay for the price of drugs. So they regulate the price of prescriptions, which is unlike what we do in the U.S.
It's an interesting collection of folks who might qualify for this in Florida when it happens. Foster children, prison inmates, certain elderly patients. Can you talk a little bit about advantages you might see to what Florida's trying to do or problems with it?
So it's fairly narrowly focused, and that really makes sense when states are thinking about importation. They're targeting groups of people for whom the state is responsible for covering the cost of the prescription. So this benefit would really affect taxpayers to some degree rather than affecting most people who go to fill drugs in a pharmacy. But I think the narrower focus maybe makes it a bit more feasible for thinking about the plan and the assessment that the FDA would have about thinking about how many drugs are being imported, and also whether it would be feasible at all to make it through the next phase, which is to get agreements in place with Canada, who has not previously been that interested in these types of importations.
Why aren't they interested?
So this is really because drug manufacturers make arrangements to sell drugs to Canada for lower prices than the U.S. And would be very unfavorable of selling more drugs to Canada just so that they could turn around and sell those drugs to the U.S. for that lower price. So it's not only Canada that might need to be in agreement here, it's also drug manufacturers. And historically, manufacturers have said they won't sell more drugs to Canada to make up for the importing of drugs to the U.S. through Canada. So in effect, Canada would have to be willing to possibly sell off some supply that is meant for their population, which would, of course, be very unpopular for Canadians.
So it becomes a slippery slope. I mean, if every state can say we can save money, they'd all want to do this, but that's the reason why it may not happen everywhere.
That's correct.
Okay. Do you think this happens and that it does start happening in more places?
So a lot of states have passed similar laws to make importation an option for the state. Some of them also have plans under review by the FDA. So there's interest by states, but whether it could further advance because of needing that partnership with Canada, that's the part that I think is really in jeopardy here. Because again, prior attempts to do this haven't really been met with open arms. And again, that really isn't Canada's fault. If they don't think they could get enough drugs to sell to both their population and the U.S., you could understand their position.
I guess in this case, they're saying don't blame Canada. All right. Stacie Dusetzina from Vanderbilt University. We appreciate your time. Thanks so much.
Thanks so much.